And we're back on our show. Happy to introduce a new cardiologist here in town. His name is Dr. Kanna Posina. He's with Cenla Family Medicine. Dr. Posina, welcome to the show. Good to have you.
Good.
Welcome to Central Louisiana also.
Thank you, and thanks for having me. Good morning.
Welcome. 6 months in Central Louisiana?
Yep, getting close to 6 months. Yeah, it's been great. It's been great.
Yeah.
6 months. My wife is from Louisiana, so
That was the connection?
Because the connection. So and I joined Dr. Craig Pierce. He's part of Cenla Family Medicine. So he said, you know, Central Louisiana is great. You got to come on out here, and the Southern hospitality you can't ignore. So I'm here, and I'm loving it so far.
Yeah, tell us a bit about Cenla Family Medicine, your connection there.
Yeah, so Dr. Pierce and I are the cardiologists that are part of the Cenla Family Medicine. It's a large multi-specialty group, but we primarily take care of all the cardiology needs through there, and we both are interventional cardiologists, so we pretty much do, between the both of us, we pretty much do anything that's, you know, within that you can do in cardiology. From A to Z of cardiology, you can say.
And heart disease in this country is very prevalent.
Very prevalent, yes, and particularly Louisiana.
Is it Louisiana ranked like the top 3 in the United States?
You're correct. Yeah, it's one of the top. It's goes between first and second in the last couple of years.
Right.
And I think it's an epidemic, and it's going to continue getting there. And obviously, our hope is that we can educate people so that they're aware of what they can do to kind of to be aware of heart attacks and heart disease, and particularly, and see what they can do to avoid it.
You hit on early screening, early detections.
Early screening, early detection, and being aware of signs of heart attacks is very important, because nowadays, compared to past, we have the technology has improved so much, where we can save someone's life if they get to if they seek medical care in a reasonable time.
Yeah. What are some of the signs?
The typical signs that you see is usually the chest pain, typical chest pain in your center of your chest, radiating to your left arm or to your back.
Yeah.
That's a typical, but sometimes you don't always, not everyone reads the textbook when it comes to these symptoms. So sometimes, especially women, you can just have back pain or nausea or getting
that's what's
dizzy.
Different, isn't it?
Yeah, that's what's different, yeah.
Okay.
Diet. Oh, I'm sorry. Go ahead, Dr. Posina.
So I think you just have to be cautious of look out. I think it doesn't hurt if you're something is different in your daily routine, and that where you have this pain. I think you shouldn't wait to get help. You should at least call your doctor's office and ask them what to do if you're not going to go to the ER.
Yeah. And diet's so important.
Diet is very important, and I think there's so many diets out there. It's difficult to choose one. I always tell my patients, pick something that you can sustain in the long run.
Right.
That's the most important. And especially for down south, I would say choosing poultry and fish over red meats. If not eliminated completely, but
be aware of it during this holiday season.
Cut down.
Now, do you have to have a referral to see a cardiologist? How does that process work?
So most of the time, all the patients that I get are through referrals, but you can call the office. I think depending on the type of insurance that you have, you might be able to come and see me without a referral sometimes.
Great to know.
Yeah, and remind everyone where you're located.
Yep, so I'm located on Bolton Avenue. It's part of Cardiac and Vascular Service of Cenla, which is part of Cenla Family Medicine.
Right.
That's right across from the police station here in Bolton.
Easy to find.
Good mile marker.
Yeah.
Dr. Posina, welcome to Central Louisiana, and thanks for dropping by. Good to have you this morning.
Thank you. Thanks for having me.
Thank you for being with us on Good Day Cenla.
In just a minute, Deb Randolph will join us. Stay with us.